Los Angeles, city of angels, walkers near and far. It is I, Angina, coming to you with a bittersweet message. This is the last episode of the Walk Show. I know, I'm super bummed too. I don't ever want it to end. But it's like I always say, don't cry because it's over. Throw a huge party because it happened. And just because this is the last episode doesn't mean AIDS Walk Los Angeles 2021 is done. In fact, we're just getting started. Actually, I'm just kidding. The finish line is coming up real soon, like really soon, like this Sunday soon, like Sunday. Yeah, I know, don't be sad. October 3rd is your deadline to raise funds if you want to be eligible for prizes. And who doesn't love prizes? Our star walkers receive a commemorative plaque and medal pin, not to mention swag items for reaching bronze, silver, and gold levels. We'll be counting all funds raised through this Saturday at midnight to apply towards incentives for teams and individuals. You can check out all of the swag items at aidswalkla.org/participate. Of course, if incentives aren't your thing or you just want to keep your shooting star going forever into the galaxy, fundraising will stay open through November 5th. So keep watching my tips and reaching out to your network for the next 5 weeks as you continue doing the work for underserved communities. This week's episode is sponsored by the Hallmark Channel. Thank you, Hallmark Channel.
Now it's time for this week's fundraising tip with Angina.
Even though we didn't all walk together in person this year, we covered a lot of ground. You saw stories from Long Beach to Baldwin Hills, from Mid-Wilshire to downtown Los Angeles, and APLA Health programs and facilities making an impact across the entire county. I mean, just look at this map. Those are all the places where your participation in AIDS Walk LA makes a difference every single year. This year, our walk challenges brought you to 3 LA County's most iconic viewpoints, showing you just how connected we all are in the fight to end HIV. But AIDS Walk LA isn't only a story of places, it's a story of people. And we've seen with our weekly patient stories, your support truly makes life better for families and communities affected by HIV and AIDS. So yes, we measure our impact in dollars, but also in the thousands of people who have greater access to medical care, prevention, and support systems so they never have to go through life alone. And that's all because of you. So thank you so much, Los Angeles. I love you.
APLA Health is about helping people live with HIV, not contract HIV, and ending the epidemic. Access to healthcare is important to end the epidemic because healthcare services, linking people to healthcare, getting them in healthcare, keeping them in healthcare, is how we're going to bring down the number of new HIV infections every year until eventually we end the epidemic.
For a number of years now, we've had the medical technology available to give us the hope of ending the epidemic. We have effective antiviral therapy available that is more tolerable now than it's ever been in the past, and more effective than it's been in the past, and simpler than it's been in the past. And we have pre-exposure prophylaxis, or PrEP, and that's been available now for almost 8 years.
PrEP stands for pre-exposure prophylaxis. That is, people who don't have HIV taking medicine on a daily basis to prevent acquiring HIV infection. PEP stands for post-exposure prophylaxis, where a person takes antiviral medication after a risky exposure where they may have been exposed to HIV.
So undetectable equals untransmittable, or U equals U, is really something that gives us this great deal of hope that we can end the epidemic. Because if we can get people on therapy and normalize their health and prolong their lifespans, we also prevent them from transmitting HIV to their sexual partners or to their children. And it's also the most efficient way of stopping HIV transmission that we know of.
APLA Health is going to contribute to getting HIV infections down 90% by 2030 by providing comprehensive care to our patients, by helping to keep our patients' viral loads undetectable so that the promise of U equals U is fulfilled, and also to provide pre-exposure prophylaxis and post-exposure prophylaxis to patients who are at risk for HIV.
We don't have to wait for some new technological or medical breakthrough in the future. We can do it now if we can get people access to care.
So for those of us who've been working in HIV and AIDS for many years, who've been through these many chapters with the disease and these chapters with AIDS Project Los Angeles and now with APLA Health, we can hardly believe we are where we are today. We are seriously talking about ending the AIDS epidemic. We have the tools, we have the systems, we have the means to be able to do this. What we need is your continued support. We need the political will, the compassion, and the commitment to get us to that final place where we can bring down the number of new infections every year, and we can really say we've ended AIDS in Los Angeles County.
And just like that, it's all over? No, are you serious? For real, it's been an absolute blast being here each week hosting the Walk Show. Thank you so much for watching, and more importantly, for participating in AIDS Walk Los Angeles 2021. As you can see from our grand total on AIDSWalkLA.org, this year has been incredibly successful. Remember, you still have until Sunday, October 3rd to raise funds for AIDS Walk LA. In the coming days and weeks, you'll still see me all up in your timeline with new clips, never before seen footage, and more exclusive content to share about important upcoming events leading up to World AIDS Day on December 1st. So, goodbye for now, Los Angeles. I love you. And this is Angina, signing off. Bye! Thank you!